Mr Speaker. I'm very pleased to take a call on this bill. As the honourable member who has resumed her seat has noted, this will be a piece of legislation coming, strange enough, into the Health Select Committee meeting, but happy to report to the House that 3 weeks in, I think there is a collegial conviviality and working very hard on the matters in front of us, although I will not illuminate the House on our some previous matters we discussed. It may be, well, while of great importance, I'm not sure everyone will want to necessarily know about the particular prophylactic elements that we've been exploring. Mr Speaker, this is a very important bill, and I'm very pleased that the Minister of Health has brought this as a first reading to this House. I'm also very pleased as the Chair of the Health Committee to be working with a fine team of people on both sides in order to help facilitate this through. As this is the first bill, I do want to acknowledge Barbara Kuriger, who is the Deputy Chair, Scott Simpson, Jackie Dean and Shane Retty from the national side, who I'm very much looking forward to working with, and of course led by the former Speaker and others in the House on the other side. I think we will make good and productive work of this bill, the Health Protection Amendment Bill. There are three broad areas to it. The first was noted around the whole Tuberculosis Act, just integrating that into an existing or another piece of legislation. I think that reflects the National Party's approach to keeping things simple and why have multiple bills when you can put them onto one. The second is around the whole UV and the use of UV rays, rather, particularly through these tanning beds. It's been a discussion point for a while. In fact, I think the previous chair, Dr. Paul Hutchison, was quite keen on this topic. It's one that strikes me as quite important and very prudent too, that the government is targeting particularly those under 18 in order to assist in their decision making. When I had worked within the health sector prior to coming into Parliament, used to do quite a bit of work around the whole plastic dermatological side when it came to do with melanomas and other skin cancers. And while I wouldn't know whether those were caused directly or indirectly by sunbeds, the damage that UV rays can do is very, very clear. And so it's really important that this bill provides some structure and guidance around that. The most important aspects, though, are of course around infectious diseases and the notification thereof. This bill is increasing the number of those infections which can be notified. The Minister has mentioned those. That's around gonorrheal infections, the human immunodeficiency virus, or HIV as we most commonly know it, and syphilis. Which is still around in society. And up until this bill, basically there's been a voluntary system of notifying, or an obligation. We're basically ramping up this in a series of steps where a duty is rightly imposed and positively imposed. To use a technical term, positively imposed on the person to provide their details to their doctor, to their health professional, and turn as well, actually, those health professionals, nurses, doctors, caregivers are under a duty too now to collect that data. So it's been discussed around contact tracing. Those who are familiar with epidemiology will know that tracking down the source of a disease or infection or some health issue is vitally important, not only for that person and their immediate family, but for us as a society as well. And this bill is a response to that, well, those exceptions which the Minister was referring to, where people refuse to give over their information and their choices around their infectious disease, now has a consequence for the rest of us. So we've heard from the Minister how that will be a graduated response. Again, we want people to voluntarily provide their details to notify the fact that they have an infectious disease, but where necessary, we will then put a positive duty that that must be done. Where then people refuse to take the treatment that is required, be that something as simple as counselling, discussion, testing, that more and more pressure can be applied for basic what is the common good of society there. So three very important aspects, Mr Speaker, brought into this bill, a triumvirate of factors, if you will, but I'm looking forward to this coming before the committee. As I said at the start, it is hard working. We are going through quite a range of petitions at the moment, all quite important. I think it was quite striking the other day that you have people come before the committee to share their personal stories, and important for us to hear and acknowledge that. So in acknowledging them, we'll also acknowledge the work that will happen through this Health Protection Amendment Bill and commend it to the House.
Ko Portal Williams.